Okay, we are ready to go. So welcome back. I hope everyone, if you did not have lunch, you at least got up, moved around, maybe got some fresh air to continue this wonderful conversation that that's been scheduled for us around health equity. So my name is Autumn Saxton-Ross. I am the Vice President of Education and Chief Equity Officer for the National Recreation and Parks Association, and I'm so happy to be here to moderate this wonderful panel. So for this afternoon, we have Andrew Trueblood, who is the Director of the DC Office of Planning. And Andrew has served as the director of the Office of Planning since November 2018. And during this tenure, he prioritized agency efforts around both housing and equity. And he shepherded the update of the comprehensive plan with a focus around housing, equity, resilience, public facilities, and COVID-19 recovery. Next on our panel, we have Ruth Lindberg, who's the project director of the Health Impact Project. And she's an officer for the Health Impact Project, a collaboration of the Robert Wood Johnson Foundation and the Pew Charitable Trusts. And it's designed to promote the use of health impact assessments and support the growth of the field within the United States. In this role, she leads the project's federal health impact assessment and health and all policies work, and oversees the project's evaluation efforts. And then last but not least, we have Nana Bailey Thomas, and she is the DC Department of Transportation's Chief Equity and Inclusion Officer. And since 2011, she has served as the Assistant General Counsel and DDOT's Labor Liaison. And in that role, she improved the agency's relations with various labor unions and skillfully negotiated several agency-wide policies. So with that, I'd like to thank our panel for being here, and I will go ahead and get started with our questions. And so I think it's very important as we talk about equity that we make sure that folks have a good understanding of the difference between equity and equality. And when we say health equity, we mean that everyone has a fair and just opportunity to be healthy. And according to the CDC, achieving health equity requires valuing everyone equally with focused and ongoing societal efforts to address avoidable inequalities, historic and contemporary injustices, and the elimination of health and healthcare disparities, or in other words, targeting efforts where they are most needed. If you have lived in DC for longer than a year, you know that our perceptions and our way of life is really defined by the ward with which we live. The Health Equity Report that was written in 2018 highlighted even more granular disparities and opportunities for health across these wards and life itself, not just within wards, but also within the 51 statistical neighborhoods within the district. And these underscore differences by income, place, and race. So I'd like for everyone to answer this question. And how are you in your agency or organization applying concepts of equitable distribution into practice? So regardless if it's income, place, or race, into your projects you implement. And the second part of that question is, how are you communicating this shift, this change in the way that we address problems within your agency and within the community? So I'll take whoever would like to go first.
Hi, everyone, and thanks so much for having me. I'll just say, I'm the director of the DC Office of Planning, as you heard, and we have had a great relationship with DC Health for many years, and we're very happy to be a partner in the Health Equity Report as you put that together. In fact, how did we incorporate it? We built it into the District of Columbia's Comprehensive Plan Update, which was recently approved by Council. Because of the work of DC Health, we actually built in some of the major findings and goals around the Health Equity Report into the district's codified plan that talks about everything from housing to infrastructure to neighborhoods. And it is now a part of really everything. And I'll just say two quick examples, and I don't want to take Director Hubbard's steam, so I'm not going to talk too much about housing, although that's really a critical question about where people live and the nexus between their housing and housing opportunities and their health outcomes and opportunities. But I will talk about some of the work so that housing has been critical, and hopefully we can continue to talk about that and the mayor's housing goals. But I'll also say around issues, for example, of economic opportunity and health outcomes. We have done some really important work, especially from out of COVID, with our Food Policy Council, supporting really a double-sided goal of supporting local businesses and local entrepreneurs and health access, food access that can improve health outcomes through our Food Policy Council. We recognize that, for example, the big grocery stores may never choose to locate in certain parts of our city, especially wards 7 and 8 or east of the river. But there are lots of entrepreneurs and lots of people who provide food and fresh food and district residents, people of color and entrepreneurs of color. And so there have been a whole host of funds, including a recent food access fund that was released to support those residents, supporting their communities, supporting economic opportunities, and supporting health outcomes. And I think that is the type of work, that cross-cutting work across agencies, across funding sources, that has been impactful in the city.
Is specific grant opportunities support economic development and food access, really prioritizing Black or BIPOC organizations or those that are led by them. Thank you. And so I'd like to also welcome Drew Hubbard, who's the director of the DC Office of Housing and Community Development. And he was appointed the interim director of the Housing and Community Development in 2021. And he has served in various roles within DHCD, including as deputy director and chief admin officer. So after that introduction, I'd like to put you on the spot and have you talk a little bit about how you are applying these concepts of equitable distribution and communicating that both within your agency and within the community.
Absolutely. And apologize, we're kind of still in this stance where if your tech is not on point, you are late getting places, but I'm glad I got in and I'm here to contribute. This is a very important issue for us, and I think Director Trueblood alluded to this with the mayor's goal of having 36,000 new units, 12,000 of which to be affordable by 2025. We became the first jurisdiction to advance and adopt an equity housing plan. So moving forward from where traditionally most of our affordable housing, just to kind of the nature of development and the like, has naturally occurred east of the river. So we are making a deliberate effort, and you can, I think, see the planning areas maybe over Director Trueblood's shoulder, where we are taking a deliberate look to attract affordable housing proposals in all 8 wards, and specifically west of the park and in areas of the city where you don't have affordable housing and traditionally. We know, as was said, decent, safe, and affordable housing is very, very critical to making sure that folks are stable where they are. And we know the disparities that exist with communities of color and some of the fraught choices that have to be made if you look at trying to prioritize things like healthcare or other needs, at the expense of a decent place to live. So we want to do what we can to make sure we have affordable housing in all parts of the city, so folks don't have to make those choices. And in particular, to support that, the mayor's put resources behind this, and we have a request for proposals that open now. With a historic amount of funding for affordable housing, is $400 million this year in the Housing Production Trust Fund to really meet that need and make sure that we produce housing all across the city, and especially in places of high amenity neighborhoods where it hasn't existed before.
Next question, those 9 key drivers, but making sure there's affordable housing where you have those places within neighborhoods that really support health behaviors, social cohesion, all the things that we know really drive health equity. So I'd love to hear from, if I can call folks out, Ms. Bailey Thomas.
Thank you. Thank you so much for having me. So my name is Nana Bailey Thomas, and I am the Chief Transportation Equity and Inclusion Officer for the District Department of Transportation. And in my role, I basically oversee 9 programs within the agency. That includes our ADA reasonable accommodations, that includes our equal employment complaints, sexual harassment complaints, as well as our DBE and our on-the-job training program. And so to answer your question specifically, one of the concepts that we implemented recently is we have an equity assessment tool. And the purpose of the equity assessment tool is that every project that's applying for either federal or local funding goes through this assessment. So we have the project managers and chiefs do an evaluation, answer a series of questions, and a lot of the questions are focused on underserved communities within the district. Another part of the equity assessment tool is to really get program managers as well as chiefs to understand where is your project touching the community. Another aspect that is very crucial to that is ensuring that we have effective and meaningful community engagement, as well as partnering with our external stakeholders. So for instance, we partner with the Commission on Aging, as well as the Multimodal Accessibility Advisory Council to make sure that we're touching the areas that we need. This is a bit of a culture change. As many of you know, DDOT was one of the first agencies to actually institute and implement an equity statement. And so from there, we then had to make sure that we were implementing that throughout the entire agency. And our current interim director, Director Lott, is very, very focused in making sure that not only are we being equitable, but making sure that we truly identify those areas that need to be serviced. And so, as many people know, transportation touches almost every aspect of daily life. I think sometimes people don't see it that way, but, you know, from the sidewalks to the bus shelters to ensuring that transit frequency is at the forefront, as well as safety. And so basically making sure that as we move forward with our project projections and completions, that we have our equity assessment tool and making sure that we truly are engaging with the community to make sure we're getting that meaningful feedback.
Thank you so much. So, and it's really nice to hear you talk about the need for culture change, right? Like sometimes when we talk about health equity, we're focused on policy, practice, institutions, and we don't think about people being part of that organization. And so the need to focus on folks so that they understand the why. So as it relates to their job, they understand why and that they're applying it in every place. So thanks so much for that. Ruth, would you like to join? And it'll be really exciting to hear as a non-government agency on our panel.
Sure, happy to jump in, and thank you so much for having me today. It's a pleasure to be here with sector leaders who are really at the forefront of thinking about how to advance health and equity from their roles. So as you heard my introduction, I direct the Health Impact Project, which is a collaboration of the Robert Wood Johnson Foundation and the Pew Charitable Trust. So we're based here in DC out of the Pew offices. For those that may not be familiar with Pew, we are a global nonprofit organization that seeks to improve public policy, inform the public, and invigorate civic life. And the project that I direct works to ensure that health equity is a core consideration in decision-making in sectors like housing, transportation, community development, education, and other areas. And so we provide training, technical and financial assistance. We support convenings and cross-sector collaboration to really help organizations and governments identify different policies, practices, and research that can promote health equity and to integrate them into their work. And we do this through a range of different health and all policies approaches like health impact assessment, legislative health notes, and some other models that I can talk about later. So in terms of the question around equitable distribution, there's a couple strategies that we have been using. One is thinking about how to use data to inform our investments and target our funding in communities. So we routinely use data on systemic inequities to inform our grant making process, to shape our initiatives and really target resources in the places that have the greatest opportunity to advance health equity. We also really elevate the importance of stakeholder engagement in our work, particularly with residents with lived experience that may be directly affected by the policies or programs that we are working to support communities in doing research and policy change on. And so that's a big priority for our team. Sometimes that means bringing people onto advisory committees to shape our work, ensuring that qualitative research is lifted up, not just quantitative research, and really bringing in the voices and perspectives of people who will be affected by policies. And then thinking about kind of an asset-based framework for the way that we shape our initiatives, thinking about assets that already are in place in communities and how our training and funding assistance can really elevate all the great work that's already on the ground.
Thank you for that. And so it's really great to hear both of you talk about this idea of our tools that you're using when it comes to who's benefiting versus who's burdened. So hearing about the equity assessment tool, hearing about the use of data to really target those historic inequities to make sure that funding is really going to the folks that need it. And so just a reminder that before we go into the next question, those of you that are joining us, you are more than welcome to put some questions in the chat because we should have a few minutes at the end of the panel to answer those questions. So feel free to submit questions on the message board, on Twitter, or Facebook. So if you see me looking down at my phone, I'm getting texts and reminders for you all as well. So moving on to our second question. The Health Equity Report was released in 2018, highlighting key insights and drivers. So those 9 drivers that you all are working in, and the agencies that each of you are working in and leading, planning, transportation, housing, and community development, are known to drive and influence health opportunities and outcomes for district residents. Could you each discuss how your agencies engaged in the idea of all policy being health policy pre-pandemic? So you've talked about some ways that you've really talked about focusing on folks that need additional support and resources because of historic inequities. But what were you doing before the pandemic? Some specific examples of how you take transportation policy or housing community development policy and really use it to drive health equity within the district.
I can start. So pre-pandemic, just to kind of set this at a baseline, we do a lot of financing of projects. And so with that, we have certain healthy housing standards that are included with accepting that funding, including our preservation fund, which seeks to really allow existing buildings to stay affordable by having resources for either the tenants or partners that they go with to purchase those buildings to keep them affordable. But one of the facets of that is, we along with the acquisition funding, also allow for emergency and health and safety rehab of those units as they look to remain viable housing units. So with that, making sure we have healthy standards in the actual physical structures that we finance. And then we also do a triennial review of the uniform physical conditions related to health and safety on these units to make sure that they remain suitable places that are healthy for people to live in. So besides just the very baseline important need of shelter, we want to make sure they're staying in healthy places that don't exacerbate any conditions or the like.
Thank you.
I'll chime in next. We were actually doing meaningful community engagement prior to the pandemic. So partnering with some of our outside stakeholders, that was occurring pre-pandemic. So it wasn't just after the fact. Also, too, as many people know, we were in the process of upgrading our long-range transportation plan, which is Move DC, and that was happening before the pandemic as well. So the pandemic didn't change how we were, operating or implementing, but what the pandemic did do is make us look at things differently to make sure that we were being more impactful.
Thanks, and I'll ask some specifics on those changes. Andrew?
I think two things. Number one, I sort of alluded to it earlier, but by incorporating some of the health equity report in the comp plan, I think we as the Office of Planning think about health through everything. And I want to give a good example of the housing equity report that Director Hubbard mentioned. He mentioned that we found disparities where our affordable housing was in the city. Those disparities we found, and thanks part to the health equity report, align not only with race and income, which we sort of knew, but also with health outcomes. There's a 15, as the health equity report shows, there's a 15-year life expectancy disparity between wards 3 and wards 8. And so if we want to talk about health outcomes, some of it, not all of it, but some of it is creating more opportunities for people to live in Ward 3. And some of it is addressing the challenges in Ward 8, but we've got to do both, right? We can't just focus on one side of the city. And so the idea that we would get all of our housing agents together and focus on creating those affordable opportunities, I think drove some of the mayor's goals and are driving very directly policy today. And I think that's a great example and an outcome of the intersection of housing.
I would say for the Health Impact Project, we were really founded because of the importance of social determinants of health in shaping health disparities in our country. And so health and all policies has been central to our work since our inception in 2009 and always a focus for us. But some of the specific ways that we have done that even before the pandemic include supporting the use of health impact assessment around the country. So that's a 6-step process that brings health and equity evidence to decisions in a range of different sectors and helps craft recommendations to try to maximize potential health benefits and minimize preventable risks to health before decisions are made and implemented. We also have worked to develop and pilot a tool called the Legislative Health Note, which sort of draws from the principles of health impact assessment, but is intended for use in fast-paced legislative sessions. And we've been testing its use for about 2 years now in partnership with the DC Council on a range of different policy decisions. And then a third example I would give is around our efforts to forge cross-sector and community government relationships, which I think are really foundational to health and all policies approaches. And so one example of that is we launched a few years ago our Calling All Sectors State Agencies Joined for Health initiative really aims to forge lasting collaborations across agencies and with non-governmental community organizations to address complex public health challenges. And DC is one of the 10 jurisdictions that has participated in this initiative with a focus on ensuring that pregnant people in the district and their families live in safe and stable housing regardless of income, race, class, culture, immigration status, and other factors. And so the Department of Health's Office of Health Equity is leading that initiative with many other partners, including the DC Community Health Administration, the DC Interagency Council on Homelessness, the Department of Human Services, the Housing Authority, and Thrive by 5 DC, in partnership with Community of Hope, which is a nonprofit here in DC.
Thank you. And I see questions rolling in, so that's great. If you can continue the questions. I have one more question for the entire panel, and then we'll move on to the questions from the audience. And so, as we all know, COVID-19 has changed really all facets of life. And as I reflect on it over and over, I hear people discuss how, they're going to change back or pivot when things go back to normal. And this pandemic has brought to the forefront these persistent inequities that we all have been are aware of, and some antiquated processes that some of us have been aware of as well. And with this disruption, some of us choose to see this as an opportunity to create a new normal. And so can you give us an example or two of how your agencies have shifted or changed, or your agencies and organizations have shifted or changed policies or practice as a result of the pandemic that you're really keeping and strengthening your role within health equity? So a pivot or a change that has really provided you an opportunity to do things differently for health equity.
I'm happy to dive in. I think a couple of the ways that the pandemic has really shifted our work. One is thinking about how to really put our community stakeholders in the driver's seat of shaping our initiatives, rather than us sort of selecting topics that we think based on the national literature or what we're seeing in trends are really important. So one example of that is an initiative that we launched in response to the pandemic to help support communities in addressing some of the pressing social determinants of health that they were facing as a result of the pandemic. And in developing that work, we spent a lot of time really making phone calls, talking with community leaders and residents about what was going on in their communities to shape that funding opportunity and figure out how we could best support them, rather than us deciding, where we should put funds and to what purpose. I think similarly, another approach that we have taken is to shift more resources to community-based organizations as opposed to governmental organizations, and thinking about in some of our relationships that we're seeking to promote between governmental and community-based organizations, how the community organizations can be the lead on that, bringing in government partners to support their work rather than the reverse, which was sometimes the way that we would shape work prior to the pandemic. And the third thing I would say is that we have been, I think, more explicit and intentional in our research and in our initiatives about really naming the role of structural racism in creating and perpetuating health inequities, and really elevating that in the context of the pandemic, where that has just been really illuminated for people in a way that they maybe were not as aware before.
Thank you.
Maybe I'll jump in next with two ideas. One is a policy and one is more of a process. The process is, I think we've all been thinking about how to better engage communities. I think the virtual platform has opened up a lot of opportunity, but also has its own challenges with people who maybe aren't as connected or not as comfortable with technology. So how do you pair that? But I would say in balance, it has been better. We've seen more engagement with a broader swath of residents than before, younger residents, for example. But we also need to make sure our older residents and our less connected residents are part of our engagement too. And so this isn't necessarily directly health equity, but I do think it relates to making sure that we are thinking about equity and health outcomes are a critical part of that. And so, for example, our food policy, once again, another overlap, council has been doing different sessions to reach residents, whether it's virtual or meeting residents in other ways. So I want to say that in terms of engagement, the policy is really around our public realm, our public spaces, and how do we really think about them differently, and especially in our neighborhoods, and especially in our neighborhoods where maybe public spaces weren't as maintained, weren't as accessible. They are great places to be healthy, being outside. Everyone, I think, appreciates being outside more, but also to recreate and to connect with people and to have strong relationships and family time. And so I think we've seen that across the city in all wards, uses of our parks, of our streeteries, used well. Block parties have been around for many, many years, but we just, for example, put out a guide to help residents do their own kind of pop-up block parties and make sure they get the right permits as needed, but a toolkit to get there. And so they can take advantage of their blocks, and more residents and more neighborhoods can do that. So I think really our public spaces are ours, and they're an important piece of our social fabric, of our health fabric, and of really what makes DC great.
Yes, I am a believer of the essentialness of parks and recreation. So changing and really uplifting that as a driver, as a place for people to connect, promote health is something that's changing. So really having community residents take on that place to have those places for folks to gather safely outside. Thanks. Anyone else?
I'll chime in. And to Director Trueblood's point, as many of you may already know, DC was actually named a gold bicycle-friendly community by the League of American Bicyclists, and we retained the gold status walk-friendly city standing by a designated walk-friendly communities. But the other point of that is that we also had to think about where are we putting our bike trails, our bike stations. And as many of you know, we just opened new miles of bike trails along the Anacostia River, and numerous capital bike share stations opened in Wards 7 and 8. So as we think about the connectivity from east of river to the rest of the city, that was a key component. And also, too, just the recreational aspect, giving the whole entire city safe places to ride and bike and be recreational.
Yeah, and so that's something. So it's kind of the lifting up again of outdoor spaces to connect, whether it's actually to get somewhere physically or socially. And I think the pandemic has really reminded us that you can do everything outdoors that you do indoors. Director Hubbard.
Yes. So we early on in the pandemic look to redirect some of our existing federal funds to do some direct supports with both rental assistance. So this was before the big tranche that came from the federal government that supported the state DC program. But we had some existing federal funds that we had a couple precursor programs really focused on making sure that folks stayed housed as a key way to make sure that the pandemic didn't spread further, during its early phases. So making sure that we can continue on to keeping those types of supports in place. In addition, we looked at some of our community-based organizations that we fund, and we actually stood up a program to support any foregone revenue that they may have due to the pandemic, so they can continue to serve our residents through housing counseling and the other services to make sure that residents could continue and still pursue safe and affordable housing. So through that, and then there are some opportunities that have come from the pandemic that we've gotten federal resources in to pilot programs, including our Homeownership Assistance Fund, which looks at helping folks who've gotten into arrears either in their first trust mortgage or condo fees, again, making sure that stability is there, that we have the supports in place kind of at scale. And one of the exciting things with that source of federal money that's going to support the Homeownership Assistance Fund goes further than we've ever seen and really targets and allows us to look at homeowners of color and looking at things like even buying down their first trust mortgage to make sure that their monthly payments are cut, to look at wealth creation and things like that. So we're going to expand on that resource from the federal government and really put into place ways to really impact communities of color and the stability of their housing.
Thanks. And so as we move to audience questions, I'd just like to, challenge all of us here today, personally and professionally, how we can see the changes as a result of COVID-19 as opportunity. So continuing to look at both practices and policies that we've started as a result. So, how many more community meetings are going to be a combination of virtual and in person? How are we going to continue to lift up and directly talk about race and structural race and grant opportunities and lifting up communities of color? So I challenge all of us to continue that as we move into and create this new normal where we can slowly but surely pick away at the centuries of structural racism that we've built within this country. And so as we transition to audience questions, one of the first questions, and let me do a direct question to Nana Bailey Thomas. Does the equity tool deal with transportation-related pollution impacts on local neighborhoods from tailpipe emissions or other things, like including idling?
There is a question related to emissions, and the question is, how does your project impact emissions? Does it get into those very specifics? No, that is for the program manager to articulate those issues within the response.
Thank you. And then so for Director Trueblood, please describe your racial equity analysis for zoning and land use as required by the comprehensive plan. So can you give a little more information about that?
Thank you. Yeah, that's. I'm glad that somebody asked. It's actually, I think it's important to recognize that equity is kind of sown. It's sown throughout the fabric of the comprehensive plan. We have an equity crosswalk that talks about all of the specific policies around equity and racial equity. There are three lenses that are required, three racial equity lenses that have been included in the comprehensive plan to be applied. One is for our 6-year capital improvements plan. And so we're working with the budget office to do that now. So that includes DDOT, every agency that needs capital improvements. And luckily DDOT's already sort of doing it, but it will just kind of go through a process of a racial equity lens for all capital improvement. We've been supporting the budget office on that. There is a small area, or whenever we are area planning, like small area plans, a racial equity lens will be required for that. So we're doing right now, one in Congress Heights we're completing, one in Pennsylvania Avenue Southeast in Ward 7 we're looking at, as well as Chevy Chase. As you think about those 3 places in your head, they will all need a racial equity lens, and you can see how they may be very different in terms of what we look at and what the recommendations are. And then finally, there's a requirement for the Zoning Commission to apply a racial equity lens to their decision making. And the Office of Planning is supporting that. We write reports to them, and we do that analysis for cases that go before the Zoning Commission. So that's when a project wants to come and ask for a zoning change or for a planned unit development. For those who know what that is, that we look at that. A big piece of that will be affordable housing, and especially if it's in high opportunity areas. So these are all, I think, important movements forward in how we incorporate equity lenses kind of across all the work that we do. And I do think, to tie it all back, they're all place-based, and they all tie back to the very important work of the Health Equity Report of the place-based disparities that we have. And I think they can help. Health will be a part of all of that. And I think seeing equity as this issue that is at the intersection of all of these different realms is really critical. And as you see with this panel, I think is true, is part of it. And I think we're all, while we're in different agencies, are moving forward to try and address these very complex.
Thanks. And that was a great way of tying it back into the Health Equity Report. Nice job there. And then another specific question for Director Hubbard. How will DHCD make up for missing mark on investments in 30% average medium income affordable housing investment? This is a specific question. In 30% average medium income affordable housing investment required by the trust fund statute moving forward, and ensure that low income requirement is met or exceeded in the future?
So the reference, of course, is in our trust fund statute. There are 2 main AMI or MFI buckets that the trust fund sets out. Those between 31% and 50% of AMI and 30% and below. And each of those has a requirement for the amount of funding to support housing, built housing, and preservation of housing for those areas. What we've done and have done over the last several years, we actually have not funded any projects over 50% at AMI. So looking at those 2 priority categories, we are laser focused on making sure that our dollars go out towards those particular residents at those income levels. What we have also done, and this is something that policy-wise changed a couple of years ago, and you have a bit of a lag when it comes to projects that are coming in, especially considering the fact we haven't had an RFP since 2019 due to the pandemic. But we do have an open RFP now that prioritizes the proposal of projects that specifically look at building units for folks between 0 and 30% AMI. So couple that with a stronger commitment, more resources towards the local rent supplement program, and a better alignment of looking at selected projects for funding to align them directly with these vouchers, because you can't do the 0 to 30% without the income and rent supports to support those particular units. So going forward, DHCD will take a more active role on the front end of having control of where those vouchers go and what projects they attach to. So we'll have a better idea of how many vouchers we have, and we can directly put them into projects that we fund so we can get to the meeting the goal for 0 to 30%.
Thank you. And then a question for Ruth. How is the Health Impact Project addressing social health, so social isolation or loneliness?
Yeah, certainly social isolation has really come to the forefront, I think, in terms of people's understanding of it as a significant public health challenge in the context of the pandemic. So we always thought about health holistically in the work that we do. And so social isolation and mental health issues have always been a component of the research that we do and that we support communities, thinking about how to make sure you're looking at effects of different policies or decisions on all aspects of health, which can include things like social isolation. I would also say that Pew, sort of separately from my project, has recently launched a new project called the Suicide Risk Reduction Project, which is focused specifically on trying to do early screening and prevention around suicide, which is obviously kind of the most extreme outcome from social isolation. So happy to share more about that offline, and I can put my email in the chat for anyone that wants to follow up.
Thank you. And question for everyone. So as you approach and discuss meaningful community engagement, how are you co-creating with impacted communities, sharing power, creating space for Black and Brown residents to not just give input, but to help in decision making? And so thinking about, meaningful community engagement, how are you co-creating those outcomes with the community?
I'll give an example that we have used in some of our recent small area plans, especially in Congress. I believe it was Congress Heights, where we actually were able to give a gift card to a young person in the neighborhood who helped us coordinate feedback and engagement with young people around Congress Heights, who is a group that we don't necessarily always hear from. And I think it was good for two reasons. Number one, just reaching out to understanding the groups that we don't always hear from and reaching out is good, but also recognizing that we're asking for his time and his energy. And we need to make sure that we, as much as we can within the confines of government, recognize that and support that. So we were able to procure gift cards for him, as well as others who took the time to talk to us, to give us feedback, to review, co-create some of the ideas with us. And, I think it's recognizing that we all want to do as much engagement as possible, but there's a time and a cost. And if all of us got all of the engagement that we all wanted on all of our dimensions, our residents would never have time to actually live their lives or take care of their children or go to work or whatever they're doing. And so I think it's trying to find that important balance as we work on these projects. And it's really about respect and also trying to find, for those who know, I know there are a lot of government people here, there are a lot of rules around government. We can't just hand out money. So finding what are the tools that we can use. And we found, for those who are in government, we found that there is a process with the OCFO to do gift cards. You have to have various procedures and controls to make sure they're not misused. But that has been a really good tool.
So what I'm hearing is finding and creating a process so that you can actually co-create, right? Because we recognize that people's time, right? People's ideas, people's engagement has value. And so to actually be able to co-create, you have to create a process where you can show folks the value of their time. So thank you for that.
Yeah, I would echo what Andrew just said around really honoring and valuing people's time. I think that's something that we've paid a lot of attention to in recent years, whether that's in engaging folks in research, when we review budget proposals for grantees. That is always a question we ask. We say, if you're thinking about doing engagement with folks as part of your project, which is something we always encourage, do you have the appropriate resources in place to really make that meaningful, and that you have given the amount of time and the resources necessary to value people's time and input. And then I think we've also thought about who are the partners and the potential grantees that are really in a position to have a long-standing, deep-rooted platform for engagement. So looking at community organizing groups that really are grounded in working with residents day in and out, and thinking about changing the types of groups that we are partnering with so that we can elevate that in our work.
Thank you. So another example of really changing processes so that you can better co-create. Those of us that work in government or large agencies understand how processes can be a big barrier to almost all we do, especially as it relates to equity and addressing directly racism and institutional racism. Director Hubbard or Ms. Bailey Thomas, any response to the question? Let me pull it up again.
So I think it was touched on before, but I think it's worth reiterating. It's kind of how we interact, right? We've learned to adapt to a more virtual way of service delivery that has the potential to engage with more residents. But at the same time, we know there are residents out there that still need and prefer and traditional means of interacting with the government, including being able to come into our buildings, having direct contact in person, things like that. So I think going forward is learning, taking what we've learned during this time period to really enhance our virtual offerings of service delivery, but also really preserving kind of our traditional outreach and enhancing it too. A lot of our direct impact with the public happens, as I mentioned before, through a lot of the community-based organizations that we fund for direct services. So looking at ramping up service offerings through our CBOs and all the different programs that they help support, and helping them really with technology and some of the supports we were able to give them to really maintain through this period, but also look at enhancing what they do and really taking what they learned and keeping it going forward.
Thank you.
I'll just chime in briefly. I think it's really important to also understand when community engagement occurs. Oftentimes it's occurring when a project's already been decided. And one of the aspects that DDOT has been incorporating is ensuring that there's community engagement as part of the pre-planning for the project. So that is actually a question that is part of the equity assessment tool. What is your community engagement strategy as you move this project forward?
Yeah, so not waiting until the project's almost done and you're having someone pick between this and this, but actually having folks at the table as the development, the plan, the project is happening. Thanks for that. So I'd like to thank our panel for joining. I know we've been doing these virtual panels for almost 2 years now, and it's still kind of weird and awkward, people dropping off and forgetting to unmute. So I thank you so much for joining us this afternoon. So next at the DC Health Equity Summit, panelists will discuss equitable pandemic response strategies and lessons learned in a session moderated by my fellow commissioner, Dr. Christopher King. We'll have about a 10-minute break before the next session, so please stay tuned. I'd like to thank our panelists again. I hope everyone, maybe a little chilly outside, but the sun is out, so I definitely encourage you to go and walk around your block before you come back to join us for the next session. So with that, thank you.